Today we'll talk about something which is very close to my heart. It's about defeating a cancer before even it starts. One of the important aspects of this philosophical idea is already in use, particularly for cervical cancer. Now, cervical cancer is a cancer which happens at the neck of the womb, at the top of the vagina, in a particular organ called cervix. Cervical cancer fortunately develops over many years. It takes between 5 to 15 years for the cervical cancer to develop. And science has given us a lot of weapons how to treat cervical cancer before it even turns into cancer. World Health Organization and scientific communities all over the world has invested a huge amount of money to understand the problems of cervical cancer over last many decades. As a result of that, we have got many world-class researchers giving us ideas and ways of treatment, how to prevent cervical cancer. We cannot prevent all cancers, but cervical cancer is something which can be prevented relatively easily. Unfortunately, in India, cervical cancer is a really big problem. We can almost say it is in wildfire in India because so many women are dying from this preventable cancer in India every day. You cannot imagine. I have written many articles on that previously, but today we'll discuss something which is called pap smear. Now, pap smear is something which is designed to pick up precancer cells from the cervix. It's not a surgery. It is designed in such a way that women during their office work can go out in the lunchtime, go to a doctor, get a cervical smear done or pap smear done and come back and join in her office. It doesn't take much time. What it does is basically with a soft brush, some cells of the cervix are taken away in particular liquid medium and sent it to laboratory to get it examined about the health of the cervix. Why pap smear is so important? It is cheap, it is widely available, it is relatively painless to do, and yet it prevents cancer. If you have been living in America or England or Australia, they will send a letter every few months or years so that you can go to your doctor to get a pap smear check. In India, we lack those kind of facilities. Yet, we can all get ourselves educated. We can all educate at least each one of our friends so that they can have this timely pap smear. I will give you a link here so that you can understand and read about pap smear in greater detail. But in a short, this is life-saving. Along with pap smear, I want to mention another important and interesting thing, which is called vaccine for cancer. Isn't it interesting? For cervical cancer, there are vaccines because most of the cervical cancer are caused by a virus called HPV virus. Of course, HPV has got different types of viruses. However, science have got some vaccine which prevents HPV from developing cervical cancer or precancer. This is very important. Like most of the vaccines, like measles vaccines, mumps vaccine, anti-tuberculosis vaccine, even the cervical cancer vaccine is not 100% fruitful. Yet, it prevents a lot of disease. It saves a lot of life. That is what is important. Today's middle-aged women lacked the scope of this vaccination in their childhood because the vaccination is usually given younger group of girls or women basically. So whoever has got still the time to get the vaccine, girls and younger women, they should get the vaccine and also get the pap smear. For them who had the vaccine, the pap smear role is still there. It's not that we can have just vaccine and not have pap smear. Of course, it's both are important, but with the vaccine and the pap smear, the two-pronged approach, the cervical cancer gets defeated more easily. Those who didn't had vaccine, they could still have this regular pap smear and then defeat the cervical cancer in most of the cases. This is important. I hope that you enjoyed the information in this video. If you have got questions, get in touch with us. This is a very significant public health message, and we should all do something to prevent such type of cancer happening.